Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about rheumatoid arthritis. Rheumatoid arthritis, arth refers to joints, ritis means inflammations, and rheumatoid comes from rheumatism, which more broadly refers to a musculoskeletal illness. So rheumatoid arthritis is a chronic inflammatory disorder that mostly affects the joints, but can also involve other organ systems like the skin and the lungs as well. Alright, so healthy joint typically has two bones covered with articular cartilage at the ends. Articular cartilage is a type of connective tissues that acts like a protective cushion. It's a lubricated surface where bones to smoothly glides against. One-side joints like the knee joints is called a synovial joint. Synovial joint connects two bones with fibrous joint capsules that continues with the periosteum, or outer layer of both bones. The fibrous capsules is lined with a synovial membrane that has cells that produce synovial fluids and remove debris. The synovial fluid is normally a viscous fluid like a jelly part of a chicken egg, and it helps to lubricate the joint. To help serve the synovial cells, synovial membrane also has some blood vessels and lymphatics running through it. Together, the synovial membranes and the articular cartilage form the inner linings of the joint space. Rheumatoid arthritis is an autoimmune process that's typically triggered by an interactions between the genetic factors and the environment. For example, a person with a certain gene for an immune protein like human leukocytes antigen or HLA-DR1 and LHA-DR4 might develop rheumatoid arthritis. After getting exposed to something in the environment like cigarette, smoke, or specific pathogens like bacteria that lives in the intestines. These environment factors can cause modifications of our own antigens such as IgG antibodies or other proteins like type 2 collagens or vimentin. Type 2 collagens and vimentin can get modified through a process called citrullination. That's when the amino acid arginine found in these proteins is converted into another amino acid, citrulline. Meanwhile, due to the susceptibility teams HLA-DR1 and HLA-DR4, immune cells are sometimes not clever enough, so they get confused by these changes and they no longer recognize these proteins as a self-antigens. The antigens get picked up by antigen-presenting cells and gets carried to the lymph nodes to activate CD4 T helper cells. T helper cells stimulates the nearby B cells to start proliferating and differentiate into plasma cells, which produces specific auto-antibodies against these self-antigens. In rheumatoid arthritis, T helper cells and antibodies enter the circulations and reach the joint. Once there, T cells secrete cytokines like interferon gamma and interleukin-17 to recruit more of the inflammatory cells like macrophages into the joint space. Macrophages will also produce inflammatory cytokines like to many crisis factor or the TF-alpha, interleukin-1 and interleukin-6, which together with the T cells, cytokines stimulates the synovial cells to proliferate. The increase inside of your cells and immune cells creates the Pannus, which is a thick swollen synovial membrane with granulations of scarred tissue made up of fibroblasts, myofibroblasts, and inflammatory cells. Over time, the Pannus can damage the cartilage and other soft tissues and also erode the bones. Activate synovial cells also secrete proteases which break down the proteins into the articular cartilage. And without the protective cartilage, the underlying bones are exposed and can directly rub against each other. And in addition to inflammatory sites, kindly increasing the protein on the surface of the T cells known as the Rankel or the receptor activator of the nuclear factors of the kappa B like it. Rankel allows T cells to bicrank a protein on the surface of the osteoblast to get them to start breaking down bones. Meanwhile, antibodies also enter the joint space. One antibody is called rheumatoid factors or RF, which is an IgM antibodies that targets the constant Fc domain of the altered IgG antibodies. Another antibody is the anticyclic citrullinated peptide antibody, or the CCP, which targets the ruinated proteins. When these antibodies bind their targets, they form immune complexes which accumulate in the synovial fluid. There, they activate the complement systems, a family of 9 small proteins that working an enzymatic cascade to promote joint inflammations and injury. Finally, the chronic inflammations causes angiogenesis, or the formations of the new blood vessels around the joints, which allows even more inflammatory cells to arrive. As the disease progresses, multiple joints on both sides of the body get inflamed and gradually destroyed. But these inflammatory cytokines don't just stay within the tight joint space. Instead, they escape through the bloodstream and reach multiple organ systems with extra-articular problems, meaning problems beyond the joint space. For example, interleukin-1 or 6 travels to the brain where they act as the pyrogenic, producing fevers. In skeletal muscles, they promote protein breakdown. And in the skin, as well as the visceral organs, they lead to the formations of the rheumatoid nodules, which are around the shaped connections of the macrophages and the lymphocytes, with a central area of the necrosis with the tissue death. In response to inflammatory cytokines, the liver also starts producing a high amounts of hepcidin, a protein that decreases serum iron levels by inhibiting its absorption by the guts and dropping it into the macrophages or the liver cells. Meanwhile, within the lungs institutions, fibroblasts gets activated and proliferated, causing fibrotic or scar tissues that makes it harder for the alveolar gas exchange. Also, the pleural cavity surrounding the lungs to get inflamed. And they feel the fluid known as the pleural effusions. And this can sometimes mess with the lung expansion. Rheumatoid arthritis typically involves multiple joints, usually 5 or more, symmetrically, meaning the same joints groups on both sides of the body. Like both hands, for instance, commonly affected joints are the small joints like the metacarpophalangeal joints and proximal interphalangeal joints with their hands, and the metatarsophalangeal joints of the feet. As the disease worsens, it can start to affect the large joints like the shoulders, elbows, knees, and ankles. During the flares or sudden worsening of the disease, the affected joints get extremely swollen, warmed, red, and painful. Over time, they become stiff, especially in the morning or after being inactive for a prolonged period of time. People with rheumatoid arthritis may develop specific deformities, usually of the metacarpophalangeal joints of the hand, such as the ulnar deviations of the finger. Deformities are also common in the interphalangeal joints, such as the so-called buttonniere, or the buttonhole deformity. This occurs when the extensor tendons in the back of the finger splits, and the head of the proximal phalanges pokes through like a button through the buttonhole, causing flexions of the proximal interphalangeal joints and the hyperextensions of the distant phalangeal joints. Another thing of the deformity is the swan neck deformity, which is the opposite. Said these hyperextensions of the proximal interphalangeal joint and the flexions of the distant interphalangeal joints. Now, in the knee joint, a one-way valve conformed with the fluid from the swollen knee filling the sunny membranes of the dispersa. When that happens, the synovial sacs and gets so swollen that it bulges posteriorly into the popliteal fossa, creating a synovial fluid-filled cyst called the Baker or the popliteal cyst. Extra-articular manifestations include non-specific symptoms of inflammations such as fever, low appetite, malaise, or muscle weakness. Organ-specific manifestations include rheumatoid nodules or firm bumps of tissues, and these are most commonly found in the skin around the pressure points such as the elbows. Rarely, they can be found in the lungs and the heart of the sclera of the eye. There's also an increased risk of the atherosclerosis and therefore heart attack or stroke. There are also anemia, interstitial lung fibrosis, and pleural effusions, which can present progressive shortness of the breath. One particular serious condition that associated with rheumatoid arthritis is Felty syndrome, which is a triad of rheumatoid arthritis, splenomegaly, and granulocytopenia, and it can lead to life-threatening infections. Diagnosis of rheumatoid arthritis usually involves confirmatory blood tests, like looking for the presence of rheumatoid factors and anti-citrullinated peptide antibody. Additionally, imaging studies such as X-rays usually reveal decreased bone density around the affected joints. Soft tissue swelling, narrowings of the joints, space, and bony erosions. The long-term management of the rheumatoid arthritis is the use of the disease-modifying anti-rheumatic medications like methotrexate, hydrochloroquine, and sulfasaline, which can help suppress the inflammations. In addition, there are a variety of medications called biologic response modifiers, or the biologics. Some biologics, such as the abatacept, work by suppressing the activity of the T cells, or others, such as the rituximab, suppress the B cells. There are also biologics such as adalimumab, etanercept, and infliximab that blocks chemokines, like tumor necrosis factors. Anakinra blocks the interleukin-1. Treatment of the acute flares can be done by anti-inflammatory medications, like Anisense, as well as a short-term use of glucocorticoids. Alright, so for a quick recap, rheumatoid arthritis is a systemic inflammatory disorder of the autoimmune origin that's primarily characterized by progressive systematic joint destructions, especially in the wrist and fingers, but may also affect other joints and many organs such as the skin, heart, the blood vessels, and the lungs. It's marked by elevated rheumatoid factors and anticyclic citrullinated peptide antibodies.